working with via benefits accounts and Benefit Connect since 2016, no, since 2021. And we have had 2 webinars so far, the last one being about 2 years ago, to help our members better understand the filing procedure and timing of claims reimbursement from via benefits accounts. Chrysler is unique. I'll say Chrysler. That's how I retired, and that's who they are. But Chrysler is unique in having something called a retiree health care account, and many of you out there might have assets in that. That is also available for your reimbursement. Many of you are familiar with it. This may be some repeat information or reinforcing information that will come from Stephen Durso. And you will also, we expect, have questions, personal questions, personal issues, claims issues we really can't handle through the screen and the response today. But we, the insurance committee, have an email address, INSCOM, short for insurance committee, at ncro.org, that you can submit personal questions to if you have already attempted to resolve them through either via benefits accounts or Benefit Connect. If you do send anything to the insurance committee to help you, we need to have as much information as possible. That would include the detail of your issue, as well as who you talked to at some point in time and when you had communication from either via benefits accounts or Benefit Connect. And we will work with resources that we have been provided through FCA to see if they can't help resolve any personal questions. General questions on the webinar presentation, clarification questions are welcomed. They'll be addressed following Stephen's presentation. And I think that's the background. There will be another person, not yet on the screen, and Jack will be moderating your questions at the end and working with the answers on that. Those that we can't answer, we will pend and we will get back to the person asking the questions and help as much as we can. Stephen Durso will be the presenter. He's the Director of Client Services on the VIA Benefits team. He has over 23 years of benefits experience in working in multiple roles, including customer service, project management, people management, and client management. His focus has been on account-based plans, including healthcare retirement accounts, which we have, HSAs, the health savings accounts that might have been carried over by you before you retired, and flexible spending accounts, which many of us had when we were active employees, but also our unique retiree healthcare account. He is familiar with claims that get processed through that.
So hello, everyone. And Rich, thank you for the introduction. I very much appreciate it. This is actually my 3rd time doing this presentation. So if anyone's in the audience that heard me before, I hope you're welcoming me back. So anyhow, like Rich said, I've been in the accounts industry for over 20 years. I manage our client service team at VIA Benefits. And everything we really do is to try to make this process easy on you. So we want to make it so that you do not spend a lot of your time accessing your funds, and we want to get you your funds as quickly as possible so you can go on with your retirement and your lives and not think about your accounts. So that is what we're focused on. We're an organization that continues to improve over time. So if you have suggestions, we always want to hear those. And with that, excited to tell you about the plans today. This is what we're going to cover. So first of all, the portal, which is our website, and the mobile application login. So I know there's probably some people in the audience who have yet to log into either of those. There's some other people who may have logged in before, but maybe not for a while. So I'll try to help both of you just to see how you can get into both of those systems. The mobile application is actually my personal favorite. I use that for over 90% of my transactions with the accounts that I have. We're also going to talk a little bit about spousal access for retiree accounts. So we have a form that you can fill out that would give your spouse the full rights to act on your behalf when they call our service center. So more information to come about that. And then going to talk about the available balance for the retiree healthcare account. So when you go to our portal, you won't see your available balance there. And I'll tell you why and give you some tips there. We're going to talk about how do you submit a claim. We'll talk about supporting documentation. And on that front, I'm going to go over some things that are good with documentation, and then some areas where not so good, where we're not able to approve based on the documentation we receive. Because that's really one of the most common ways that a claim can get denied, is if we just do not get all of the pieces of information we need to process that for you. And if that's the case, we'll ask you to resubmit with that additional documentation. But if you listen carefully to the advice that I'm going to give you a little bit later in the presentation, you'll know what you need to get to us in order to get your claims approved. So we will talk a little bit about pending approved claims. So I know there are a lot of people who have claims that are approved, but you don't currently have any balance in the account. And when new funding is added in 2025, then those claims will pay out. So we'll talk more about that. We'll talk about duplicate claims. We hope to avoid those wherever we can. So if you've submitted a claim once, we ask you not to submit the same claim a second time. Also, we'll talk about uploading a receipt. So there's ways to do that on the portal, the website, and then there's also easy ways to do that on the mobile application just by taking a picture with your phone. Sometimes I find that to be the easiest way. We'll talk about HRA auto pay. So that works with Medicare Part B, and I'll go over that. We'll talk about the paper claim form. So we always suggest that you enter your claims on the online system or the mobile application if possible, but we do make a paper claim form available if you're unable to use either of those technologies. If you use the online or mobile app, sometimes it can be easier and quicker, but we do have that paper claim form. I'm going to give you some tips there as well. We do require direct deposit for reimbursements. So we'll talk a little bit more about that, how you can set that up if you have not already, and then what that looks like. And then what we were saying is that at the end, I have my colleague Jack joining me, and we'll answer whatever questions you have. But again, not about your personal situation. We can answer questions about the process, the program, but if you have something that's very specific to a medical condition or premium, we ask that you hold those and follow the instructions that Rich gave you. Okay, starting off, so the first thing we're going to go over is how do you get onto our technology? So portal and mobile application log on. So with the portal, there's multiple entry points. So we, again, try to make this as easy as possible. You can log in from Benefit Connect. And if you do that, you do not need a separate password for Via Benefits. You can click right in with single sign-on. So what that means is that if you click on the Benefit Connect link to get there, it's going to just send you right in. You can see that down below there on accounts. So this method does not require direct login. If you do end up wanting to use the mobile application, you'll need to set up a login, but we'll talk about that on a future slide. But you can see all the way at the bottom there, there's a link that you can click directly into your accounts. Okay, you can also directly log into our site. So the site is viabenefitsaccounts.com. We also have the Via Benefits Accounts mobile application. And when you get to those, you're going, if this is your first time that you've ever been to our site or the mobile application, either one, then you're going to select Create Account under New User. I'm going to show you a screenshot of that on an upcoming slide here. We'll ask you to enter some identifying information so that we can identify you on our system. So you'll enter your social security number, date of birth, and zip code, and then typically we'll be prompted with your information, and you'll be asked to enter an email address as your user ID. And next, you'll be prompted to create and verify a secure password. So after signing in, you're going to get a code. by email that you'll need to enter. And then we'll ask you to set up a secondary contact method, so phone, most common, to ensure account security. You can always update these settings later on the mobile app or website. This is really the way that you register for the first time. And for those of you that have already been in the portal and in accounts, you don't even need to pay attention to this slide. You've already taken care of that step. Okay, so this is the direct login. So if you go to viabenefitsaccounts.com, you will see this here. And if you're a new user, like we just talked about, you'll click in that middle box that we have highlighted that says create account. And then returning users would enter their email address in the top right. So as a new user, like I had just mentioned, it's going to ask for some of that information that we need to identify your account. So that's going to be your zip code, your date of birth, and your social security number. Enter those details in. And then this is just, you enter those details in, and then this is just a shot of what the mobile app looks like. So the mobile application, like I said, this is my favorite way to access accounts. And it's available on both the Apple App Store as well as the Google Play Store. So whatever type of phone you have, you can download the corresponding mobile application. And the logon that you use that we just walked through for the website is the exact same logon that you'll use for this mobile application. But saying that, you also could just register on the mobile app. So you don't have to go to our website or our portal. If you're someone who does everything on your mobile phone, that's perfectly fine. You can come here and click on that new user, and then you'll see the screens look identical to what we had on the website. Try to make that as easy as we can, and you can just enter your details and register just like we showed you on the portal. So this is what I was talking about before. So we do offer spousal access for retiree accounts. So I know sometimes one spouse may be responsible for doing the affairs and the financial matters, and that is okay. If you want your spouse to be able to access everything on your account when they call the customer service center, there's a form, a HIPAA authorization form, and you can get it on our portal under the forms section. So if you click on the account, the HRA, then you'll see there's a forms button, and that bottom form, HIPAA authorization form, you can click on that and download it and send it in to us. And I think it's on the next slide here, you'll see a sample of it. So you can give two different kinds of access. You can give someone full account privileges or limited privileges. And by filling this out and getting it into us, you're giving access to that person, so spouse, in order to fully be able to get all the details on your account. Okay, now the claims processing section. So this is one of the more important sections, because what I want and what we really look for is that every time you submit a claim, we want to be able to approve that for you. So we want to make sure that you've submitted the right documents, and then we really do want to approve that for you. But this is what we were talking about before, where on the retiree healthcare account, there is not a balance. And you'll actually see when you go onto our portal that there's a little blurb that tells you why that is. So in order to check your balance in the account, you actually have to contact Merrill, a Bank of America company. There's a website and then also a phone number. So you can request reimbursement through your retiree healthcare account and track its status through the Via Benefits Accounts website and mobile app. So it's available on both of those. But you cannot see your balance for this account. So just keep that in mind. So another key point under this plan is that in order to receive reimbursement, you must have the requested amount in the Merrill Institutional Money Market II Fund, referred to as the fund, or transfer enough funds into that fund to cover the amount requested prior to submitting your reimbursement requests. So I want to just stop on that point and say this is one of the more common reasons that a RHCA or retiree healthcare account claim could be denied, because maybe there was not enough money transferred over to that fund before you submitted your claim. because when you submit a claim to us, we have to check the balance before processing. And if there's not enough in the account, then we're unable to process it. So if there's one piece of advice for today, make sure you keep that in mind, that you really do need to move that money in order for us to be able to reimburse you. And then again, another thing to say is that if you choose to be reimbursed from your retiree healthcare account only, but there's not sufficient funds in your Merrill Institutional Money Market 2 fund, we will deny it. So of course, at that point, you can move the money and then submit the request again, and we will help you out, but that will delay your reimbursement. So just keep a mental note that before you submit a claim towards this plan, you want to make sure you've already taken that action to move the money over.
Yeah, and this is Jack from the VA Benefits team, also jumping in on this one. Not only do you need to make sure that you initiated the move to the money market account, make sure that the movement is completed as well before submitting to us. Because sometimes what we've seen is where people will submit the claim and then go in and move it, or immediately move it first and then submit the claim. And by the time we've communicated with the Merrill system, it is not in the institutional money market fund yet. And so Merrill will tell us that there's not a balance. So not only do you need to make sure you make the move and submit the move, please ensure before submitting to us that the move has been completed and is sitting there in the money market account before you submit the claim to us.
That is a great point, Jack. Thank you for jumping in with that. Okay, this is a sample timeline. So I'm just giving you a picture of how this works. It is a process because of the fact that we have to check that balance with Merrill. There is some timing to this, so it's not an immediate process. But so really, if we get a claim approved on a Wednesday, let's say that the claim was approved today, we're going to send that to Merrill tomorrow on a Thursday to get a confirmation of the available balance. Merrill will respond to us on Friday, letting us know if that balance is sufficient. And I'm assuming that it is, the claim submitted on that next Monday to Merrill for reimbursement. Merrill will confirm that reimbursement next Thursday, and then the claim would be processed next Friday for payment, and the claim would be paid a week from Monday. So this is a process that can take a couple of weeks. So in the scenario I just said, it's 12 days, but a good expectation is it can take up to about 2 weeks. So that's why you really want to pay attention and make sure that money is moved over before you submit your request, so there's no further delays in the process. And then at the bottom here, you will see that if you mail a claim to us, so let's say that you're using one of those paper forms, which I'll show you a sample of that in a bit here, it can take a while for the mail to get to us. It can take up to 10 days. So just keep that in mind. If you submit it electronically, oftentimes if I submit a claim electronically and then go to bed, the next morning when I wake up, that claim has already been processed by our claims team. So when you get it to us quicker, it allows us to process it quicker, which is another reason that we do suggest that you use the online technology if possible. And you may be asking, well, how would I do that? And that's on this slide here. So how do you submit a claim? I will say this recently changed slightly. So we've been making some tweaks to our claims flow to try to make it easier for you and more intuitive, and just to try to help you as much as possible. So the first thing you will see, and I think this slightly changed about a month or so ago, is you'll click on Add New Expense in the top right-hand corner in order to submit a claim. And then the first thing it's going to ask you is, what kind of expense was it? So is it a premium? Is it an out-of-pocket expense? We'll talk a little bit about both of those types of claims, and you'll enter that detail in first. So next up, you will enter your policy period. So if it's a premium for 2025, you can enter the entire year, and that it's $200 a month. We'll ask you to enter the carrier, so Blue Cross Blue Shield in this case. And then it's also the individual covered. So David D. Adams is the person covered under this claim. So then you can decide where you want us to pay that reimbursement to. I know the vast majority of people have reimbursed to themselves, but some people do like to maybe pay a doctor's bill. You can have the payment sent directly to a provider. So that is an option for you as well with that bottom link. Then after that, we have your payment method. And Jack, actually, if you could jump back to the last slide just briefly. So you can see the payment method there is Ally checking. So we do need a direct deposit on file in order to process a claim for you and pay it out. And this person in this example set up their Ally checking account, so that's where we're going to make that payment. Okay, next up are supporting documents. So we need you to upload supporting documents in order to validate your expense. One part of this presentation that I'll be going through, we're just a few slides away, is going to be some examples of good documentation versus incomplete documentation that we cannot approve. So I'll show you some examples of both of those, but right here in the claims flow, you are going to see exactly what we're asking you to put on that documentation or to provide to us a document with that information. So it's these 5 pieces of information: the policy period, the premium amount, the carrier, the individual covered, and the premium type. That is what we need for any premium expense in order to process it. And we'll go over that in a little bit as well. But we give you that guidance right in the claims flow in case you forgot what I said, which I'm sure none of you will forget everything I said. But if you did, when you get into this claims flow, we'll give you that reminder there as well. And then also in the claims flow, we'll give you you can click on that link and see an actual example of a premium receipt. And then we tell you some of the things that are not going to be acceptable documents, which I'll give you some examples of that in a little bit here as well. So in the bottom there, you see browse for files. So that is going to be uploading documents. So if you can take a picture of your claims documentation and then save it on your computer and upload it. So that's a pretty easy thing to do. And you can see we accept multiple different types of file formats. Maximum upload is 5 megabytes, but that's usually sufficient. I think sometimes what I've seen is if you can save it as low, medium, or high quality. If you save it as medium, you're pretty safe. If you go the highest possible quality, it could get over 5 megabytes, so just be careful with that. So now this person has already attached a receipt, and you can see that little paper clip at the bottom. So that shows a link to what they attached. You can click on it to see it, and you can add another file if you wanted to add 2 different pictures. That's perfectly okay. And then once you've done that, you have made it through the claims process, and you're going to hit that review button on the bottom. So it'll give you a summary of all of the things that you entered on the prior slides. So first we have the premium, we have the policy period, the total amount, the carrier, the individual covered. We show where it's going to go to that Ally checking account. And then you can view your supporting documents as well. At the bottom, you will see a disclaimer, and that's just our legalese, just saying that you're submitting this reimbursement request to be reimbursed, and then it gives you some other information, mainly that you are not also going to submit this same reimbursement request elsewhere. So you should only be reimbursed once for any expense, and that's ultimately what this disclaimer is telling you. But now you click that submit button, and you are done with your process. You've successfully submitted your $2,400 premium for reimbursement. Nothing more is required from you in this reimbursement. So you'll receive status updates on the dashboard. I know that direct deposit takes about 1 to 3 business days, and typically we're processing these claims quickly. They're generally processed on our system within a couple of days, and oftentimes it's even quicker than that. Okay, this shows you what I consider the easier way to upload a receipt is on the mobile application, because you can just take a picture right directly in the flow. But it's very similar to what you just saw, where you'll add a new expense when you get to the mobile application, and then you'll add what type of expense it is in step 1. Step 2 will be the details, just like we showed you on the portal. You'll enter the amount, the provider, and then you'll select how we're going to reimburse you. So are we sending this to you? Or are we paying it to a provider or carrier? You'll notice we really try to strive to make our website and our mobile applications similar. We try to make them a one-to-one comparison. They have all the same features and hopefully all the same ease of use. So here on the left, you'll see this similar to what we showed you from the website. It'll give you some tips. So it'll let you know that these are the 5 pieces of information we're going to look for. Gives you some ideas of what acceptable documents would be. And I'm going to do that soon as well. So explanation of benefits are always excellent documents. Provider statements, premium statements, those are always going to be good. But some unacceptable documents might be statements only showing a paid amount, balance information, bills for services that have not yet occurred, or any document that you send to us where maybe you've cut off a piece of the document and we can't see all of the information. So that's one other thing, a piece of advice that I would give you as well, is when you submit a document to us, make sure that if you've taken a picture of it, you capture everything. Because I've seen it before where we'll get a picture and maybe it cuts off one piece of information. And we really wanted to approve that claim, but we can't with the picture that you've submitted. So we would need you to resubmit. But that's just something to keep in mind as a tip. And then you're going to submit this claim, and just like you saw on the website, you're all set. There's nothing more required from you. And your claim's going to be processed by our claims team within a day or two, and then it'll be on the way. For supporting documentation, so premium statements are good. Social Security benefit award letter, I know that typically has your Part B, can have your Part D amount on it as well. So notice of Medicare payments due, explanation of benefits, itemized receipts. For paid premium expenses, you can give us that adds one more thing. So if let's say that you're someone who likes to pay for your premium for the entire year. We can actually reimburse you for the entire year if you give us the last thing you see on the bottom here, proof of payment. So we can pay for any current or past month without proof of payment, but for future dated months, we need you to give us that proof of payment in order for us to pay. So said another way, on the bottom, for paid premium expenses, we need a supporting document that includes the top 5 that you see there, and then we add proof of payment. That's only going to be required if you're requesting reimbursement for a future month, though. Okay, now we're into the sample section of this presentation. And I'm going to ask you guys to suspend reality and use some imagination here, because we have blacked out some of the details because these are actual documents. And we felt like it would be important to show you actual documents and samples because these should look very similar to what you get in the mail and the documentation that you have. But in order to do that, we had to block out the identifying information. But really, anytime you look at a document, what we want you to get in the habit of is taking those tips that we showed you in that claims flow and looking for the 5 pieces of information. So first of all, we have a coverage period, and you can see that is 2021 clearly on this document. Then you can see that we also have the premium type. So there's Medicare Part B on here, there's Medicare prescription drug premium, Part D, so that is on here. Then we have the provider, which is Medicare. We have the individual service, which is in the name field, and we definitely have that one blocked out. It's right below that 2021 box. And then also the premium amount. So this is a perfect receipt. We have everything that we need, and we will be able to process this one for you. This is another sample of a very common type of documentation that we receive for a premium. That is great, and it has all of the pieces of information that we need. So you can see down below, the second highlight, or the second little circle, is coverage period. So we have that. We've got the premium type, which is Medicare supplement. And then we also have the provider, which is United Healthcare. We've got the individual service, which is actually blacked out towards the top, and it's actually in 2 places. It's Dear the person, and then in the top right, you see the insured member. And then we have the premium amounts as well. So this is an excellent document. This gives us everything that we need in order to process your claim. Okay, now we have not such a great document. So this one is incomplete because it really does not have who the payment was for. So this is a document, I think this is a Social Security reward letter. And the problem that we have here is that they've taken a screenshot of it without providing us who the payment was for. So without any type of identifying details about who it is for, we're unable to process. So even though it does have some of the details that we need to know who it was for in order for us to be able to process. Okay, this is a checking account sample, and on this one, I will say this one is incomplete for a very similar reason as the last one. So it's missing who the payment was for. It's also missing the coverage period. However, I will say, if you have one of the other documents and you're just trying to provide us proof of payment because maybe you paid for the entire year, you can give us this document to show us the proof of payment element. So if you give us the other document that shows us all 5 pieces of information and then add this as proof of payment, that will allow us to pay for future months. But if you solely give us this document, it does not give us all of the information we need, and we would have to deny your claim. Okay, this is another example. So this person requested premiums for the month of January through December of 2023, and they submitted this in February of 2023. And you know what? They gave us all 5 pieces of information. So they gave us the coverage period, the premium type, provider, the individual service, and the premium amount. But we did not get any proof of payment. So because of that, we're able to approve for January and February, and then we would not be able to pay any future months. Now, one thing I will say is that if you were to submit this to us, we can pay January and February, and then we would actually automatically set it up to recur for the future months through the end of the year, where we will pay you for March, but not until we get to March. Okay, shifting a little bit here. So now we're moving over to an out-of-pocket healthcare expense. So this could be a doctor visit. It could be another eligible expense. And on these ones, we need different information. So first of all, we're going to need the date of service. So that is very important. We need the expense type or category. So medical, service description there. We need the provider or carrier. So was it Dr. Smith? That type of information. We do need the individual service and then the amount as well. This is some good supporting documentation. So this is from the Milton Hershey Medical Center. And you can see we've got a date of service, and that is the visit date up on the top right, 4/23. We've got the expense type, which is HOSP pay. That's under the description there. It's got service codes. We've got the provider. And then we also have the individual. So it's Eric and the last name there. And then we also have the amount. So this is an excellent receipt. It gives us this person paid $25. So we'd be able to reimburse this person $25. It has all 5 of those pieces of information that we need. Now this is another printout from a checking statement. So on a checking statement, it's not going to give us the service date. So you can look at that example there. If this person was submitting for that $15 request, it has a date of 6/10, but that's the date that the card was swiped or the transaction hit your account, which may not be the same thing as the date of service. So your date of service could have been from your appointment 2 weeks ago, and you're just paying for it today. So that's why we can't use that 6/10 date as the date of service. And then also, your checking statement's not going to tell us what service was rendered, also who it was for. So really, if you're submitting for an out-of-pocket expense that is not a premium, checking printouts are not really that helpful. Okay, where can you find a list of eligible expenses? So if you go onto our portal, there's a link on the bottom right. So all the way on the bottom right for view eligible expenses. Super easy. So again, we kind of just talked through this a little bit, and I gave you some warnings up front. So from the main page, selecting add new expense is how you really get this process started. And that's going to be for paid premium expenses, also for out-of-pocket healthcare expenses like doctor visits and prescription drug copays. If you only have either the HRA or the retiree healthcare account, we're just going to pay from that account. But if you have both, you must indicate from which account you wish to be paid. So that includes your HRA, and then when your HRA is exhausted, your RHCA, so your retiree healthcare account. Now that is going to be something that will be required when you're going through the online process. So it will not allow you to continue through the flow until you make that selection. So it works every time. However, when you're filling out one of the manual claim forms, so if you have decided that you wanted a claim form and you're going to fill it out on a paper, this can become an issue because I'm going to show you on a future slide here, we have some boxes. We need you to check the right box and not check all boxes, because if you check all boxes, we cannot guess your intention on which account to pay it from, and we would have to deny your claim, and we'll send, and a new claim would need to be submitted. So I think that's on the next slide here. Actually, it's a couple slides forward, so we'll keep going. So this is a slide that just shows you adding the new expense, and it shows you the online process to select HRA only, RHCA only, or HRA and then RHCA. And one of the good things about an online process is you're forced to make that selection in order to complete your claim. So I know you'll select the right one, and then we will proceed with that direction. So what is the claim status for HRA? So when your reimbursements are paid, we're going to notify you. So we're going to make an explanation of payment available online. So that reimbursement is going to appear as via benefits in your direct deposit account. So if you're looking at your checking account, you'll be able to see that. And then if any part of your reimbursement request was denied or not approved, via benefits accounts will provide you with an explanation of unpaid expenses by email or mail, depending on your notification preferences. So you may need to take action, such as providing additional supporting documents. So if the documents that you sent to us did not have the 5 pieces of information that I covered that we really need in order to process a claim, then it could be denied, asking you to submit that additional information. There's also the case where maybe you've submitted a claim where you don't have sufficient balance in your HRA. We will pay as much of the reimbursement request as possible. So if you were to submit a claim for $200, but you only have $100 remaining in your account as of today, we would pay you that $100, and then the remaining amount would be paid when the HRA balance is sufficient. And if you're thinking about that, HRA funding usually happens in the first week of January. So that extra $100 would be paid out after the funding is loaded in January, and then we'll send that second payment out for $100. Okay, on this page, you will see the retiree healthcare account, and you can kind of see your past activity. You can see that this person, I think they've had November has already been paid, but we're waiting to pay out December. It's just a good example of what that would look like on our portal. So this is where you actually have the option, you can download your claims information. So you can download in 2 different formats if you want. We allow you to just get that information. This premium that you see here is a recurring premium. And all that means is, like I referred to before, if you submit maybe your January premium to us, we can process that premium in January, then we can recur it and pay you the same amount for the rest of the year. So pending approved claims, this kind of talks to the example I mentioned maybe 3 minutes ago. So if this particular person, they do not have a balance remaining as of today. However, they have $18,971.50 of claims that they've submitted, and we've approved, but we just have not been able to pay out because the balance was not sufficient. So that's okay, and as soon as new balances are added and funding is added, we will pay out. So these claims can add up over the course of the year or even over years as you continue to submit for allowable expenses. And that actually brings up a good point. Even if you have no balance, you're welcome to submit claims and we will pen them for you for when you get new funding. And then again, each year in January, when that new annual contribution amount is posted to your account, these pending approved claims will pay out all at once. So if you have a large amount of pending approved claims, this could even exhaust your full annual contribution amount. So if you have no pending approved claims, any prior year balance is automatically going to carry over into the new year. And then the payment for pending approved claims will be made by the middle of January. So just keep that in mind as well. So duplicate claims, we really don't like duplicate claims because we just want to pay you once for a reimbursement request. And having duplicate claims can make it a little bit more challenging on our claims team. So we do certainly watch out for duplicate claims and we look to not process them, but it's better if you don't submit them at all. So always try to avoid submitting a claim more than once. So some common reasons why someone may submit a duplicate claim. Maybe their balance is exhausted and the claim was approved, but pended due to lack of balance. You definitely don't need to submit that again. We have it, we've approved it, and we're just waiting for that new funding to come in January. So please don't resubmit that because it's not going to make a difference. We really just need that new funding to come in. Another thing that can happen, so we have what's called auto pay for your Medicare Part B reimbursement. And what that means is that monthly we will just pay. And for next year, that's going up to $185. So if that is paid on, but turned on, and then you also submit for that expense, that would be a duplicate. So you can only be reimbursed once for each expense. So we ask if you have auto pay on for Medicare Part B, not to submit your Medicare Part B premiums for reimbursement because that will happen automatically. And then I'm going to show you how you could actually turn that off if you prefer to be reimbursed on your own timeline and submit that on your own. There's a way to do that as well. But we try to make it easy for you and just reimburse you monthly for that expense because we know that everyone has that expense. Then a claim currently in processing, maybe you submitted it a few days ago and our processors are working through it and you just completely submit it again. We ask you not to do that. And then another thing that can happen from time to time is maybe someone might fax or mail the same form in multiple times for the same claim. Definitely would ask you not to do that because that can make the claims process more challenging for us to just reimburse you one time, which is our goal. So here's what I just talked about, the HRA Medicare Part B premium auto pay function. So this is a convenience for all of you. So we include a handy health plan auto pay feature where your Medicare Part B premium reimbursement request will automatically be processed every month. And this defaults to on. So it is in the on position for everyone who has not turned it off. However, if you prefer to submit these on your own, you can always come to our website, our portal, and right under HRA there you see health plan auto pay. You can just click on that little button that says on and it will toggle to off. So that's definitely an option that you have. But for most people, they just leave it on and take that $185 reimbursement monthly. That is what the amount will be for 2025. Okay, and yes, you can definitely turn off the auto pay function for Medicare Part B premiums. It's super simple. You can see right under the HRA there. You click on that little on button, and then you'll see we'll give you a little bit of a warning because we want to make sure that you understand the ramifications of what you're doing. So if the feature's turned off, you can have your reimbursement amounts paid from your account, but you're going to have to submit them yourself. So just keep that in mind as well. Okay, where can you find a claim form? So the first thing I would say, If you're able to, please use the technology. So submit a claim on the website, the portal, use that mobile application. That's going to be the preference. It gets things to us almost immediately, and we'll get those processed for you as quick as possible. So that's option A. If you're unable to do that, we do make a claim form available to you, and you can get that form directly on our website. So if you go to the forms section after you log on to the website, you'll see right there, it highlights the FCA Healthcare Retirement Accounts Reimbursement Request Form. And you can request that, you can download it, and then you can fill it out. And I think we have a picture right here. So this is what I was talking about before. So first of all, this is what the form looks like. And we'll need you to enter some identifying details at the top. And then you enter your premium information. So you'll see the different information that we need at the bottom. And then most important with this process is you need to make a selection, just one selection on the right here. So if you want these funds reimbursed from your HRA only, just check that box. If you want it from your RHCA only, check that box. And then the third box is HRA, then retiree healthcare account. So you want to check that box. Unfortunately, sometimes we do get paper submissions where they have gone rogue and done something different. So let's maybe forward to the next slide. I'll show you what that looks like here. So this could be someone who maybe they didn't check any box. And if you don't check any box, we're not able to process. So again, you've given us the details for your claim, but you did not check how you want us to pay. So because there's no account selected, we do not know what your intention was, and we're not going to guess for you. We're not able to do that. We do really need this piece of information to process your claim. Okay, here's the other thing that can happen. If you select multiple options, that doesn't really make sense. There's no way that I can reimburse you for $754 on HRA only and RHCA only. It has to be one or the other, or you can select the HRA then RHCA. But bottom line, we just want you to select one of those boxes on the right for each reimbursement request, and then we will know exactly how you want your reimbursement. Okay, this will give you the address of where you can send the paper form. So there's our PO boxes right there. Again, the preference is, if possible, to try to use our technology, but if you need to send us the form, there's the details that you can see as far as where you would be sending the form. We do ask if you're mailing documents, we're unable to return them to you. So one suggestion we could make is, if it's a document that you really want, maybe you could just make a photocopy of it for us and then send that to us, because we cannot return documents that you've sent to us. Okay, direct deposit is a requirement under this plan. So we generally do not send out paper checks. And as of December of 2022, we made this change to move to only direct deposit for many reasons. Mainly, you know, it's safe, it's convenient, it's very quick, it's the easiest way to get you money. It reduces the risk of identity theft that is involved with a paper check, and eliminates the possibility of losing a check or having one stolen. It's just going to be faster than waiting for a paper check to arrive in the mail. And it also removes the hassle of traveling to your bank to deposit a check. So for all of those reasons, the way that the accounts are set up is that we require you to set up a bank account for us to pay. And we make that very easy for you. But if you were to submit a claim and not have a bank account set up, we're unable to pay you. So that's why it's important to set up your direct deposit information with accounts as soon as possible. For anyone who's been receiving ongoing payments, I'm sure you've already taken this step. But if you're newer to the program, you'll want to make sure this is one of the first things that you do, so we can pay you quick and easy by that direct deposit. It's actually very easy to do. So we will need you to provide us with your account number and your routing number for the bank account that you'd like to use for direct deposit. You sign into viabenefitsaccounts.com, you set up that information. We will do a validation on your bank account, which can take a couple of days. And then once that goes through, you are all set up with that direct deposit account. And that's what we will use to reimburse you in the future. And again, here's where you will see on the site where you can get to the banking information. And then we try to make it as helpful as possible. We only want one account for direct deposit, and then we also give you a little picture of a check. I know I can never remember routing versus account number and which one is which, even though I've known that for all my life. So it's always good to have a visual representation of that. And we include that on our site to just make it handy for you. Okay, how do you request help? So let's say that you needed assistance and you don't understand something that is going on. Maybe you have a reimbursement that you want to submit and you're not sure if the document in your hand has everything that you need. You can call and talk to one of our representatives who will talk you through that. There could be various reasons you might want to get in contact with us. So first of all, you can access Benefit Connect at fcabenefits.ehr.com to learn more about the healthcare retirement account, the HRA, or the retirement healthcare account, the RHCA. So single sign-on is available from there, and we showed that on an earlier slide located on Benefit Connect. And then for questions related to your HRA funding or eligibility for the funding, including account coverage start dates, you want to contact Benefit Connect. And now for submitting claims, you go to viabenefitsaccounts.com. Again, if you wanted to, you can go to Benefit Connect first, and there's an easy link which will single sign on into Via Benefits accounts. Some other warnings that we have is that don't go to myviabenefits.com/FCA, because that is our site for Medicare enrollment assistance. And then also oftentimes if people will Google Via Benefits, there's multiple different links out there, and it's not going to take you to the right site. So we really ask, if you're coming to our portal, it's much better to just type in the web address, viabenefitsaccounts.com, and then you know you'll get to the right place. That is where you go to submit claims, or you can use that single sign-on method through Benefit Connect. Then, we have representatives who are available. They're here to help you out with any question that you have about your accounts. So you can contact Via Benefits Accounts. We're available Monday through Friday from 8 a.m. to 7 p.m. Eastern time. And then we also allow you to open help tickets on your account through the Via Benefits Accounts website. That is also available in our mobile application. So that's another way that a lot of people like to interact with us, because maybe it's outside of the time of 8 a.m. to 7 p.m. or maybe you just don't prefer to call. You can send us a quick message in that help ticket, and we will evaluate your question and get back to you quickly on that one. So how do you open and submit a help ticket on our portal? You can see on the right there, the Open Help Ticket button. And if you hit that, it will open up a window and allow you to enter the details of what your question is. And then our team of experts will review your question and get back to you with a response helping you with your concern. So thank you. That is my entire presentation. I think the main things I'd like to highlight again are just make sure when you're sending in those documents that you're following the guidelines. We give you those tips in the claim flow. Give us those 5 pieces of information, and this will go easy for you. We'll be able to process your claims with no issues and no delays. And I think with that, we're at the question and answer section.
All right, so this one's a little bit individual situation, which we kind of discussed we wouldn't be able to answer, but if you're saying that there is you submitted a 2025 premium and it's being split up, it's because we didn't get a proof of payment with that submission. So if you only submitted the premium statement, that's only going to tell us that you're eligible for the premium itself. And so we would set up a scheduled payment cycle for you through the year that it's effective for. If you paid it out of pocket and you want to get reimbursed for the whole thing, as Steve mentioned in one of the previous slides, you have to provide proof of payment in order for us to give you everything at once. Otherwise, it's going to be scheduled throughout the year.
So just that one extra document, and then we can pay you for the whole year.
Yep.
And if you have done all that and it still failed, please send it to the insurance committee, and and we'll pursue why or get it double checked. But as Jack said, you may have submitted an imperfect and incomplete claim that was interpreted by the claims processors at the benefits accounts properly because they didn't have all the information. But if you did, email to inscom@ncro.org, and we'll pursue it on your behalf. Dale, thank you for putting up the email address.
All right, which works part of you. We could get reimbursed for mileage for going to doctors, clinics, and for picking up prescriptions. Via benefits does not allow it. Why? I think this is a specific case-by-case scenario on what you're submitting for and when. I believe, Steve, mileage going to, if you have to travel for a procedure, would be a qualified expense depending on the scenario, correct?
I agree. There's some very specific guidelines and amounts that are qualified based on the IRS. So this is one where you may want to call our call center and they can walk you through that process, because it's one of the more complicated types of claims to submit just because it follows all of those guidelines.
Yeah, it's a little bit more nuanced compared to something that's a little more cut and dry from the IRS standpoint on what aspect of it is allowable. Long-term care, I believe yes is the answer to that question. I just have to go to the site that we talked about, pull up the eligible expense list and read it back to you, but I'm fairly sure that the long-term care premiums are one of them. I don't have the full list memorized on my head, but I'm pretty sure that it is. We can take it back and confirm, Rich, if we need to, but I'm pretty sure that one is. Yep, same. That is determined by Stellantis, FCA, Chrysler, FCA Chrysler. But yeah, that is determined by them. But yes, we've been informed it's going to be the same in 2025 as 2024. That is, so in general, not much, but I would recommend calling the Benefit Connect Service Center to assist you, because they're the ones who determine eligibility and send the actual records down to us. So we had their contact information in the presentation. So if you have questions about coming up to 65, the experience, what you need to do and provide, give them a call. They'll be able to assist you. Yes, that would be, so yes, so from a survivor standpoint, again, this is kind of a nuanced question depending on the situation for this person. I would recommend them calling Benefit Connect first to determine what because that would help and provide all the information that they require in order to speak with them. And that would determine what benefits they do have as far as, because it might not just be an HRA, they might have a RHCA, in which case if they're deceased with a RHCA, they would have to contact Merrill Lynch. So to try to get the payment out. So to kind of, the best experience would be start with Benefit Connect from that regard. They'll help the person determine what benefits they do have, and they should be able to provide them each contact number necessary in order to determine balances, determine beneficiary payouts, that kind of stuff. That would be my recommendation for this person. I'm sorry that they are going through that. That's rough.
I notice if I'm DLI on.
Yeah, right, Rich, I can hear you.
Good. I've noticed that this is my retiree friend passed away yesterday. I can hope and don't know, but I can hope that the retiree had named a power of attorney, medical power of attorney, or beyond the medical, even somebody who is able to represent them and provide the power of attorney information to Benefit Connect, which I expect that they would need in order to answer somebody other than the retiree.
They will need power of attorney, and I believe a death certificate is usually the two things that are the most common requirements. So that's what we need also. So after it goes through Benefit Connect getting all that, and I'm sure whoever they had with 401k, whoever they might have with any other at Merrill Lynch might need that too. So those are the two common ones: is a power of attorney documentation and some form of death certificate. So you can prep them that they'll probably need those. But I would definitely, as far as where to start reaching out to Benefit Connect first.
I see that the closing of it says that they may not have logon information. Then again, they might have logon information, and certainly to everybody out there, and myself and us, provide those records to your survivors so that they can get online and file claims even afterwards for that 1 year for the HRA, 1 year following your death, following the death of an eligible person.
And Rich, sorry.
Please go ahead, Jack.
What I was going to say is Steve mentioned one of those, which was the HIPAA authorization form in the event of death. If you provide, or excuse me, if you provide that prior to death, then someone who might be your caretaker currently, so let's say someone's helping you out already, if you fill that out and provide it, then they've already potentially got a means of, calling and accessing your stuff. You would still need to, provide things later on, but then at least they're kind of already aware of what's going on. They can talk about it, that kind of thing. And then once you submit the documentation with the certificate of death and the power of attorney, then you would be able to access it from there. Even though what you described is much better, is to make sure that they, before it gets to that, they have a means of accessing and doing everything they need to.
I do see what Dale pulled up on the screen. Dale, do you want to describe it, or shall I?
Go ahead.
Please, in a couple locations on the NCRO website under the health insurances area, either on Medicare or pre-Medicare, there is on the right-hand column the link specifically for Guide for Survivors. Click here, it says for Survivor Guide, prepared and recently updated by the Insurance Committee, and coordinated, the answers were coordinated with FCA HR representatives, and we believe this is totally accurate, but it is a multi-page guide on contacting Benefit Connect and or dealing with all of the aspects that have to do with Chrysler benefits after retirement, from optional life insurance to retiree health care account to the HRA and all the aspects. So that's on the website and can be downloaded. Recently, it was emailed out that there were updates, emailed out to all those retirees whom we have email addresses for. And at one point, 4 years ago when it was done, it was mailed out in hard copy.
So for those who can't see, any benefits to logging in directly to VIA versus Benefit Connect. So the main benefit is that if you log in directly on the website, then you won't have to sign up again to use the mobile app. So then you can just pop in, do what you need to do, and log in with your mobile app at wherever you are. We definitely encourage the mobile application because it's significantly faster and easier to upload images of your receipts and premium statements than doing, mailing it in or faxing it in, or even going on the website. Sometimes, getting the image from your phone. If you took a screenshot, you don't have a scanner, but like you take a picture from your phone, getting the picture onto your computer and then uploading it, sometimes that's a pain in the butt too. So by using the mobile app, you can even take a picture, load it on the mobile app, and then you can select it on the website. So by having direct logged in instead of using the SSO, you now have a login that you can use. You can leverage the mobile app as well as direct login into the site. And sometimes it's just, you just want to log in, quickly check a balance or check something. You don't necessarily want to go through the whole rigmarole of going to Benefit Connect, SSOing over, that kind of thing. So that would be the main benefit. But if you don't anticipate needing that, you just get your Med Part B auto reimbursements every month and you really just want to occasionally check it, that would be a scenario where it probably makes the most sense to just do the SSO and not have to go through the hassle of setting up a login. If you are, what we currently have integrated is that you automatically get Medicare Part B auto reimbursement. You do have to attest to it in Benefit Connect. You do have to go into Benefit Connect and attest that you are eligible and signed up and paying for Medicare Part B. And from there, it will cascade down to us, and we will automatically process and pay it on a monthly basis based on what the Med Part B supplement is in any given year. So that'll just automatically happen as long as you're sent through.
Upcoming is $185 a month for 2025 is the base rate.
Yep, 185, like Steve mentioned in the presentation. So yeah, that'll be next year. If you're referring to any other premiums, we do not have a direct integration with them. So what we do have is once you get your statement loaded up and submit for scheduled reimbursement throughout the year. So that's as close to automatically as we can get without having a direct connection with them. So that's the easiest way. And then each year when your policy renews, you would just go in and submit in December, January, November, whenever you get that policy renewal document. Then you would just resubmit for that scheduled reimbursement. So you would get that every month. The only reason that's a little tough to answer without seeing the actual image, because every image could be different. It could also be different how it got uploaded into the system. So especially if it was mailed or faxed, it can sometimes be totally illegible. Another reason why we don't recommend mailing or faxing is sometimes as it comes through and gets processed, it especially fax looks really bad. So that there could be a number of things. That particular CVS might have their receipt system set up in a way that doesn't show it correctly. So it might show up as not actually showing that this is an RX expense or something. So there's a lot of factors without looking at it. What I would recommend is on the website, there is an option to say that, ask for more information on this specific claim. And then our claims team will re-review it and provide you a little bit more detail if that's what you're missing. Or call our service center and they'll open a case for you and the claims team will review it. And they'll help give you a more detailed answer on why it's getting denied.
And Jack, I would just add to this one, the most common reason if you took a photo is you might have taken a photo that cut off one piece of information. So maybe your photo didn't capture the entire document and it was missing just one piece of information, and we'd need you to resubmit in that case.
Yeah, that's most common for photos.
From personal experience, I'll echo the contacting the benefits center, the VA Benefits Accounts Center. I haven't done it online, but I've contacted where they've told me what I was missing in my submission. And how to perfect it.
And Rich, to that point, if they see something when they're speaking with you, they're like, I don't know, you know what, let me resend this through the claims team. They'll do it. They'll do it on the call. I mean, the claims team will need a day or so to, a couple of days to re-review it, but that's a great opportunity to utilize them. To your point, Rich, if you don't want to go log in and go through that process, call us. We'll be able to do it for you. There are, so what happens, so to kind of get into the nitty gritty of how the RHCA process works, Merrill Lynch has essentially two different buckets where the funds are. And you move the money market to account is you direct it to go into that place. And so after we process the claim and send to Merrill Lynch saying, hey, this person was approved for $100, they look at that money market account. If there's $100 in there, what they do is they move it to the frozen account, and it sits in that frozen account until they process the payment record of the claim, and then it leaves the frozen account. They send us the money, and then we pay you that amount. So it kind of essentially, once it leaves the money market account and goes into this frozen account, it means that no other transactions can touch it. It's like it's there in a safe holding spot to be moved into, you know, a payment, essentially liquidate out and send to us. If you're seeing that you have an older claim, that the funds are stuck in the frozen account, then you should call us and let us know and ask the service center to look into that for you. And we can work with Merrill on the back end of things to kind of look into it, because from our side, we really can't see the Merrill system. We just have that direct file feed connection with them to kind of send back, okay, here's what was approved, how much is in their money market, okay, thank you for that. We process, we send the claim total amount to be paid out, and then they tell us, yep, here's the amount that we've liquidated out of the frozen fund that you can pay them. So if anything is happening outside of that exchange, we only see what they tell us to on that file, and their team can only see what's on their interface. So but that doesn't mean we can't escalate and look behind the scenes if this is just sitting there. Now it will sit there until it gets paid out. So it will be there potentially, like Steve said, 2 to 3 weeks, depending on when you submitted, when it was approved. But if you're seeing this sit there for like months on end, and it's the exact same amount and hasn't changed, then please reach out and escalate that, and we can look into it and work with Merrill to figure out what's going on. But in general, that's how it works. My guess is something triggered an identity flag, meaning maybe one of the times you put in your social security number, it was off by a digit or something to that effect, and that could kind of flag our system. I also want to call out that in our system, we do not have your employee ID. So if you're trying to use your employee ID, it's not going to work. And Steve kind of mentioned to specifically called out when you're setting up, you have to use your social security number. So maybe that could also be what's triggering that, is that you're trying to put in your employee ID. It's not recognizing that there's an employee ID in our system that matches that. And it's saying, hey, we can't find you, please call us. So that would be one of those two things, either a couple different attempts at SSN not going in correctly, or you're trying to use your employer ID and we don't have it in the system, which is the case for your population. We don't have employee ID.
Yeah, but that is our call center number, so it is a legitimate request, and we really want you to call us, and then a representative will be able to quickly help you.
Yep. Yeah, good call out, Steve. They are capable of assisting with getting you set up and running.
Gentlemen, I have about, I'm going to say 30 or 40 more questions that are queued up here. I don't know how much longer we want to continue plugging on these. I leave it up to you. We still have quite a few people. There's 100 folks still out there, so it's up to you how long you want to continue.
I'm good to go through a few more, Steve, if you are.
Yeah.
All right.
I'll
give you the next question.
5
Yours
or 10
rock
more
and
minutes.
roll.
Let's do it.
Yeah. When a claim is rejected due to incomplete supporting documentation, do you provide enough information to let us know specifically what is missing or incorrect on original claim submission? We try. And so when we have a denial in our portal and in the mobile app, but especially in the portal, we give an explanation of why it's denied, and we try to include information on what to provide in there. Sometimes it can be a little bit not as clear because sometimes the denial is more nuanced, and so it's harder to say give us this one thing if the way it's presented in the document is a little bit not cut and dry. Like, it's not just totally missing service date or something, and we just say, hey, you're missing the service date. Give us a document with service date. So we always try in the denial messaging. If it's confusing though, please call our service center. They can absolutely help you work through it and explain and give you some alternative documentation you might be able to provide to, you know, approve, get an approval.
Or you could submit a help ticket too if you don't want to call.
Or yeah, actually that's another great example, because when you submit a help ticket, more often than not, we will give you a more detailed answer on the denial reason and what to provide along with it, in case it wasn't clear for you in the denial messaging. I would recommend calling the Benefit Connect Service Center for that question. The receipt does not have my name, but it does have all other required information. This is day service, location of the pharmacy, and medical category. The pharmacy is not. Pharmacy does have their telephone number on receipt. We will not be calling people on your behalf if you submit a claim and it's denied. You need to make sure that all information is provided on the documentation so that we can review it and approve it based on IRS rules. So the monthly Medicare payment for me and my wife will use up the annual amount before the end of the year. Will Via drain the annual amount and send it to me? Yeah, make sure you sign up for direct deposit, and we will. And then what will happen is if we exhaust the balance before the end of the year and you're still signed up for auto pay, Steve mentioned this, they'll turn into what's called a pending approved status. And then once you get your contributions for 2026, it will pay out any of those last remaining months. So let's say you exhaust in October and November and December come in, those will pend. And then when you get your contribution January 2026, it'll pay those out that mid-January timeframe. So yeah, well, make sure you sign up for direct deposit. Otherwise, no, you're not going to get paid. But as long as you're signed up for direct deposit, absolutely.
Yeah, and Jack, this is really the easiest situation because you've signed up for direct deposit. You have nothing else you need to do. We're just going to take care of it from there on out. We'll pay you monthly. If you run out of money, we'll still pen those claims and add them for when you get more funding. But that's the easiest way to go. If the Part B reimbursement drains your account, then you really don't even have to take any action year over year unless your bank account changes.
Yeah, and one call out, we didn't really talk about it on our section, but if you have problems with accessing the site for whatever reason, or caretaker or whatever, you can call us and request a paper direct deposit form and mail it in also. So we do accept that, and we would mail it out to you. You'd fill it out and send it in. So you don't necessarily have to go in. We do recommend it because it's much faster, safer, and more secure than mailing a paper form with your bank account information on it. But we do accept it for those who aren't able to do it. It depends is the answer to that question. There's rules on whether she has to be, forget exactly the specific rule, but she has to be showing up as a spouse on your account with the Benefit Connect system. And at the time you pass away, as long as she's showing as an eligible spouse in their system, we will get a surviving spouse account in her behalf, and we'll get a balance transfer record that will move whatever you have remaining into her account when it is established.
I can mention that survivor guide on the ncero.org website does directly answer that, along with a number of other questions I expect people have.
It probably goes into more detail on that specific eligibility too, right, Rich? Because there's a rule on timing of the spouse showing up too. I just forget what it is offhand.
I don't know what the timing rule is. I do know that with respect to the deceased retiree or even a deceased eligible spouse, that the claims can be filed for up to 12 months following the claims for while the person was alive can be filed for up to 12 months following the date of death.
Yeah, that's a good call out. We didn't bring that up in our presentation, but yeah, you do have 12 months to submit for the deceased. You can actually leverage the new surviving spouse account to do that. You don't have to go back to the deceased retiree account to submit. But yeah, that is also true. And yeah. I know we can't from the Med Part B file, and Steve, I don't think we can, if they submit manually, we can pay less than what's on the documentation. Is that correct? I think
Yeah,
it's
we usually
whatever's
pay
on the
what is on the
documentation we have to pay.
documentation. Exactly.
Yeah, so if you have documentation showing you're not paying the full amount, then you can manually submit it. You would pause the auto pay, the auto pay functionality, and then manually submit the documentation that shows you aren't paying the full 185. That way you would do it, but the auto pay is always going to come over as 185, unfortunately.
Sorry, spud my mouse.
Yes, so if the amount of the claim is greater than your balance, the claim would not, it would be. So we would pay out what's available. So if you have, let's say $10 left in your account and you have an eligible expense for $100, the whole claim is approved, but you won't be paid $100, you'd be paid $10. And then once a new contribution comes in, you would be paid the 90. Where it wouldn't be paid, and it wouldn't work that way, is with RHCA. So RHCA, we would only pay what Merrill Lynch comes back to us and tells us how much you have remaining, and then the rest is denied, and you'd have to resubmit for the remainder, or resubmit the claim in order for us to, after you've moved the money to the money market account, for us to be able to pay out that remaining amount. So RHCA is a little bit different because it's all based on what Merrill tells us your balance is in that money market account at the time we send over the claim record that was approved. So with HRA, it pens and then it's paid out later. You don't have to do anything extra. For RHCA, that remaining amount is denied based on what Merrill Lynch tells us you actually had in the money market account at the time of us sending the claim record over.
Jack, do we maybe want to take two more?
Yeah, we got, I think, 5 minutes. So whatever we can bang out in 5 minutes.
Sounds good.
How to link HRA and RHCA online to auto from RHCA when HRA is exhausted without filing contract. So the auto pay functionality is specifically tied to the HRA. It does not automatically come out of the RHCA, and that is because of the essentially the nature of the RHCA, where if you miss 1 day, 1 month, or you forget to move the amount over, it's going to deny, and you're not going to get paid for that. And you'd have to manually resubmit that anyway. So what I would recommend if you want the RHCA to cover your Medicare Part B is to pause the auto pay functionality and and then manually submit and schedule that to be coming out of the RHCA for the remainder of the year, so that's what's triggering that. Auto pay is always going to come out of the HRA though. Yes, so there's what's called two-factor authentication when you create an account or log in to a new system or to a computer that you haven't used in a little bit, where we want to authenticate and validate that this is actually you trying to log in. So you're going to get either a text message or email with a code that you would go back to where you're trying to log in, whether that's on your phone or on the website, and provide that code. So yeah, that's part of the process. It's a security measure.
You can
Probably.
pay providers. If the question is, we can actually, instead of reimbursing you, if you submit us a receipt with the right documentation, you can select to have a payment sent to a doctor.
Yeah, it's called Pay to Provider on the site or the mobile app or on the claim form. But with you have to provide all of the details necessary, to pay the provider. We request certain information. I think like address, name of the provider, and some other details, which normally is on the invoice they send you. So it should be on the invoice that they requested from you. But you can submit claims as far back as the origination of your plan. So if your HRA started in 2016, you could submit claims from as far back as 2016, and we'll process and accept them. The only run out for the RHCA and the HRA is, like Rich said, if the person passes away, there is a 12-month run out to submit claims for the deceased. But otherwise, you can go back as far as it was established. That's the key. And in our site, if you go into coverage periods, you'll see the establishment date as that coverage start date.
And I believe that with respect to the retiree health care account, I understand that you can go back to when you're retired, even if that's before the HRA was established.
That's true, but that's also on the site, Rich. If you go into the RHCA section, it'll show you what we have as the start date.
Right.
But to your point, it should be, I believe is the retiree date, usually, more often than not.
Mm-hmm. That's a lot for me. Thank you.
So yeah, they could be not exactly the same day, to your point.
I think you just answered this.
Yeah, unused funds, it depends on the situation. If you do not have a surviving spouse on file with Benefit Connect, your family has to submit documentation so that they can access the account and submit documentation on the deceased behalf for 12 months. And then if you do have a surviving spouse on file, a surviving spouse account will be created in their name and the balance will be moved to them.
This is an area where it's a very significant difference between the HRA and the retiree healthcare account.
Yes.
With HRA, there, we know that, I was going to mention this at the end, but we know that there are retirees who have large balances in the HRA and the retiree healthcare account. It could be deliberate. It could be just from lack of going through it. Maybe there's a descendant who's handling things now and learning about this through this webinar. But upon death of the retiree or an eligible surviving spouse or both, there is this 12-month run out for eligible claims for the individual. But after that, any HRA amount becomes forfeited. I'll use that word myself, but it's ineligible for further reimbursement. The retiree healthcare account is different. There is a death benefit payable from the retiree healthcare account that was put in it when it was established in the mid-90s, and it remains. I've had that verified. And there is on Benefit Connect your ability to name a beneficiary for that retiree healthcare account. Am I correct on that, Stephen or Jack? Is that where that's done?
I believe so.
There needs to be a beneficiary.
Yeah, you have to have a beneficiary on file. I will say that in the event that you do have a surviving spouse on record, the RHCA actually moves into their name. So the beneficiary payout won't happen if you do have a surviving spouse. If the surviving spouse passes, then that beneficiary payout would take place. Or if there's not a surviving spouse on file, that's when that would come into play for the deceased retiree. But I believe I know for a fact Merrill Lynch gets them. I don't know if you need to put anything in directly with Merrill Lynch offhand, Rich. We do not collect it on the account side. So in Via Benefits, you wouldn't put the beneficiary information because we don't do the beneficiary payout. Merrill Lynch does. I just don't remember, to your point, if it starts at Benefit Connect and cascades out, or if you go to Merrill Lynch directly. We can take that back. One more question, then we can call it.
Thank you. Thank you.
Yeah, good.
I love to see that. And we want to get better too. So if you have feedback on how we could get better, we're interested in that all of the time as well.
Yeah, always. If we can, is to our ability. Yeah, we want to improve it.
Figured that was a good ending.
Good. There are still a few people on. I could close just by mentioning the reason that the timing is of this here in mid-December, I'll call it, is a reminder that there are HRA balances to be restored or deposits to be put in or available. I can't never really do hard deposits, but there are available funds beginning in January, by mid-January. And sometimes people forget that, the reminder of that, but also on how to use them, how to access them, and that there's some cases where it'll be paid out in partial or in full, depending on pending claims, and others that will be paid out over the year as claims are submitted or auto pay happens. So our timing is deliberate here in December to help you be aware of what's going on for next year. And also I'll mention that the presentation, after we receive a PDF, a file of it, will be put onto the NCRO website over the next few days. And the video, Dale will put into the, he'll work on doing whatever magic he does with the video, and it will be on the YouTube site, the NCRO's YouTube site, and we'll be reminding our members of that either by email or on the NCRO site.
Hey, Rich, I have one comment to jump off of what you just said there. Is that okay?
Yeah, please. If I misstated anything, let me know, please, Jack.
No. It's a solicitation for those who we want to make sure you get paid. And so there are a number of people that we have who, since we've signed up for since we did the direct deposit requirement, who are just banking money over and over and over every month. It's just, waiting for you to sign up for, or if you're in one of the very few exception processes to get a check, please, if you are in this situation, call us, let us help you sign up for direct deposit, get your money. The other aspect of this is in the beginning of next year, we will be doing some outreach to those people to try to say, hey, you got funds sitting here, please sign up so we can pay you. But I would just ask that everybody that has listened and is still on, check to make sure you see direct deposit set up in your account, or call us to make sure that we see that you have direct deposit set up and available, and there wasn't an error or something got lost in the mail. We want to make sure you get paid and get your money that you deserve. So just wanted to toss that out there before we left.
Thank you. And we on the with the NCRO reinforce that too. We know that there are people. We've been told there are people with large balances, and this is hopefully to help those who are handling that account, or help the individuals, the retirees themselves, begin to get reimbursements, knowing that they can reach back to prior years for claims. If they do have a large balance, they don't just have to wait for it to be reimbursed month by month, and get your money back. Okay. Stephen for presenting, Jack for Q&A, both of you for your knowledge and service to our members, but also to all the retirees who have accounts there at VIA benefits accounts. We give you a huge thanks, a great appreciation for putting this together.
Thank you, Rich, and thank you, everyone. Thanks for having us today. Appreciate it.
Thank you for having us.